Ever wondered why some people experience unexplained joint pain, stiffness, and swelling? It could be more than just age catching up. It might be a condition known as rheumatoid arthritis, and affecting millions around the globe. This autoimmune disorder continues to baffle scientists and researchers. 1.5 million people in the United States who have rheumatoid arthritis. In women, RA most commonly begins between ages 30 and 60. Women are 3 times more likely than men to develop RA. RA is rare in men under the age of 45. So, what exactly is this condition? Rheumatoid arthritis, or RA, is a chronic inflammatory condition that primarily affects the joints. But unlike osteoarthritis, which results from wear and tear on the joints, RA is an autoimmune disease, and this means the body's immune system mistakenly attacks its tissues, causing inflammation and potentially leading to joint damage. And the exact cause of RA remains a mystery, but it's believed that a combination of genetic, physical, and emotional stresses and environmental factors trigger the immune system to act up. Now, what are the symptoms? In the early stages, people with RA may not see redness or swelling in the joints, but they may experience tenderness and pain. And these symptoms are clues to RA, and joint pain, tenderness, swelling, or stiffness that lasts for 6 weeks or longer, morning stiffness that lasts for 30 minutes or longer. More than one joint is affected. Small joints, wrists, certain joints in the hands and feet are typically affected first. The same joints on both sides of the body are affected. Many people with RA get very tired, fatigue, and some may have a low-grade fever. RA symptoms may come and go. Having a lot of inflammation and other symptoms is called a flare. A flare can last for days or months. So how does a rheumatoid arthritis affect the body? Well, it's not just about joints. Inflammation from RA can spread to other organs like the eyes, dryness, pain, inflammation, redness, sensitivity to light, and trouble seeing properly. Also, inflammation of lungs, heart, and even the blood vessels. It can lead to a wide range of complications, from lung disease and heart problems to bone erosion and joint deformity. It's also important to note that RA can affect more than just your physical health. Living with chronic pain and coping with the limitations of a progressive disease can take a mental and emotional toll, leading to conditions like depression and anxiety. How to diagnose RA? Getting an accurate diagnosis as soon as possible is the first step to treating RA effectively. A doctor with specialized training in treating arthritis, called a rheumatologist, is the best person to make a correct diagnosis using medical history, a physical examination, and lab tests. First of all, the medical history, and doctor will ask about joint symptoms like pain, tenderness, stiffness, difficulty moving, when they started, if they come and go, how severe they are, what actions make them better or worse, and whether family members have RA or another autoimmune disease. In physical examinations, the doctor will look for joint tenderness, swelling, warmth and painful or limited movement, bumps under the skin, or a low-grade fever. Important blood tests to look for inflammation and blood proteins, antibodies that are linked to RA, and these antibodies would show the severity of the disease. When it comes to managing rheumatoid arthritis, the goal is to stop inflammation or reduce it to the lowest possible level, relieve symptoms, prevent joint and organ damage, improve function and overall well-being, reduce long-term complications. A combination of medication, lifestyle changes, and physical therapy often proves most effective. Medications can help manage symptoms and slow the disease's progression, while lifestyle changes like maintaining a healthy diet, regular exercise, and adequate sleep can improve overall health and well-being. Physical therapy can help maintain joint flexibility and range of motion. Despite the challenges, many people with RA lead full, active lives. With the right treatment and a positive mindset, it's entirely possible to manage the symptoms and minimize the impact of the disease on daily life. To recap, rheumatoid arthritis is a chronic inflammatory disorder that affects more than just the joints. It's an autoimmune disease where the body's immune system mistakenly attacks its tissues. It can cause a range of symptoms from joint pain and stiffness to fatigue, and can even affect other organs in the body. But with the right treatment and lifestyle changes, it's possible to manage the condition and lead a healthy, active life. Remember, if you're experiencing unexplained joint pain or other symptoms mentioned, it's crucial to seek medical advice. Early diagnosis and treatment can significantly improve the quality of life for those with rheumatoid arthritis. Stay informed, stay healthy.